Hello, and welcome to this video on epidemiological studies. In this video, we'll give a quick overview of what epidemiological studies are, the different types, and their pros and cons. What is a study? A study is a scientific way to answer a question using data from a group of people, called a population. The question can be anything, like, does smoking cause cancer? Is one area more affected by a disease than another? What food caused a disease outbreak? Every study starts with a study question. What do we want to find out? Next, we choose the best type of study to answer that question. Then we collect and analyze the data using the right statistical method. After that, we interpret the results and report them. Most importantly, all studies must be done ethically. Ecological study. An ecological study looks at disease rates and exposure information in a group, not in individuals. The group could be a family, a city, or even a whole country. These studies help compare health across locations, like measles rates in Australia versus New Zealand, or over time. They can also help create new study questions. But remember, ecological studies apply to groups, not individuals. Case series. A case series looks at a group of people with the same disease or exposure. It helps describe who gets the disease, demographics, how it shows up, symptoms, and what happens over time, prognosis. Case series are also useful when something unusual is seen. For example, in the early 1980s, a rare type of pneumonia helped identify HIV. Cross-sectional study, or prevalence study. A cross-sectional study measures health information at one point in time, like a snapshot. Health surveys are common examples. These studies often use questionnaires to collect data. They're useful for measuring how common a disease is, prevalence, looking at several health conditions and exposures at once. They're also quick, low cost, and easy to conduct. But since they only collect data at one time, they can't prove cause and effect. Case control study. A case control study starts with two groups: cases, people who have a disease; controls, people without the disease. We then ask both groups about past exposures to possible risk factors. We calculate something called an odds ratio. If the odds ratio is more than 1, exposure might increase disease risk. If it's less than 1, the exposure might be protective. If it's 1, there's no link. These studies are useful for investigating foodborne outbreaks, studying rare diseases, being quick and low cost. But they aren't good for studying rare exposures, and people might not accurately remember their past exposures. Also, finding good control matches can be hard. Cohort study. A cohort study follows a group of people over time to see who develops a disease. It collects information about risk factors early on. Then we compare people exposed to a risk factor, people not exposed. We measure relative risk. If it's more than 1, the exposure may increase risk. If it's less than 1, it may lower the risk. If it's 1, there's no difference. One famous example is the British doctors' study in the 1950s, which showed how smoking causes lung cancer. Pros of cohort studies: show the time sequence of cause and effect, allows study of multiple outcomes and risk factors. Cons: can be expensive and time-consuming, not good for rare diseases. People may drop out over time, affecting results. Interventional study. An interventional study tests an intervention, like a medicine, vaccine, or health advice, and checks the outcome, like changes in disease or behavior. The RCT is the gold standard for this. Here's how it works. People are randomly split into two groups. The intervention group gets the treatment. The control group does not. After some time, outcomes in both groups are compared. In a double-blind study, neither the participants nor the researchers know who got the treatment. This helps reduce bias. Benefits: give strong evidence that the intervention works. Randomization ensures fair comparison. Limitations: often costly, may need many participants, not always ethical or practical. Summarizing studies. There are also ways to summarize multiple studies on the same topic. Systematic review collects and reviews all high-quality studies on a topic, gives a clear and balanced summary of the evidence. Meta-analysis combines data from similar studies, uses statistics to give one summary result. We've covered what a study is, types of epidemiological studies, and their advantages and disadvantages. Understanding these studies helps us learn more about disease, risk factors, and how to protect public health.